Good morning, everybody. I'm Dr. Emilio Sacco, and these are my disclosures. We know that widespread cancellation of elective surgery and prioritization, according to an emergency urgency principle, have been the main features of the early reaction of surgeons to the COVID pandemic. In line with the dynamics of the pandemic in Italy, functional surgeries cancellation rates reached the peak in the months of February 2020, and trends toward progressive return to pre-COVID surgical activity have been noted from May 2020 onwards. Patients' fear of visiting hospital, especially those receiving COVID patients, has been noticed as an unmeasured barrier to the return to normal levels of activity in the field of elective urological surgery, causing patients to postpone or decline their procedure. So our aim was to assess the extent of this phenomenon in our male urinary incontinence referral center, located in a urban academic hospital with a COVID facility after the first year of the pandemic. This was a retrospective review of data of patients scheduled for male urinary incontinence surgery. The study period started in July 1st, 2020, when we started to return to the pre-COVID activity, to March 30, 2021, so study period of 9 months. We compared this data with the data of control period with the same time frame pre-pandemic from June 1st, 2019 to February 29, 2020. Male urinary incontinence procedures for which patients were scheduled were implantation of fixed slings or of artificial urinary sphincter. The primary endpoint was percentage of patients operated on and percentage of those postponing or definitively refusing their procedure. Looking at our result, in particular to the rate of patients postponing or refusing their procedures, we noted a statistically significant difference between the COVID period and versus the control period. 73% of patients declined their surgery during the COVID period, compared to about 12% during the control period. Looking at the rate of postponement refusal by type of surgery, we noted a numerically higher number of patients declining surgery among those scheduled for implantation of artificial urinary sphincter compared to those scheduled for implantation of slings. However, the difference was not statistically different. Looking at the time trend of rate of postponement refusal of surgery, we noted higher rate of declining surgery when we started to recover functional surgery in July in 2020 and we performed a univariate risk factor analysis evaluating several risk factors, and among these risk factors only incontinence severity and waiting time for surgery were statistically significantly associated to the risk of declining surgery. So patient deferring surgery caused significant organizational trouble that made it difficult to effectively recover the accumulated surgical backlog due to COVID pandemic. In our experience, this patient's behavior was mainly due to patients' fear of contracting coronavirus during the hospitalization. Risk factors for surgery declining were lower degree of incontinence and shorter procedure waiting time, indicated that for these patients, COVID-related anxieties overcomes suffering due to incontinence. So in conclusion, COVID-related anxieties should be carefully addressed in all patients scheduled for surgical treatment of urological non-life-threatening conditions, which already require an accurate risk-benefit balance evaluation. Setting COVID-free patients' pathways and healthcare facilities, shortening hospitalization as much as possible, together with a shared decision-making process and case-by-case discussion, may be effective strategies to manage this phenomenon. Thank you very much for attention.